Well, a warm welcome to this talk. It's Sunday the 21st of March. It's a weekend, so I'm not going to do too many numbers, but we'll start off with some news from the States and Europe. And we're going to look at Russia today as well. Oh, and if we get time, we'll have a report from Australia as well. Now, the situation in the States, you've probably seen that news footage about the partying in Florida and the police forcibly breaking it up. Thousands of people in the streets. Now, it's not so much the outdoor activity that's the concern, but it's what goes on in the bars after that, before that, what goes on in terms of socialising before and after that could well be super spreader events, as it seems tens of thousands of young people especially are going to Florida for their spring break. So it is going to have implications, there's no question about it. Now, hopefully the vaccines in the States will be ahead of this, but this is definitely going to cause at least some localised increases. Young people, of course, going from Florida back home to wherever they're from are going to spread the virus with them. And of course, the implications for the people of Florida could be quite significant as well. So the curfew technically is 8 p.m. to 6 a.m. It is enforced. That's probably going to be there till April. Now, the news report, this one says hard partying crowds, which presumably means quite a lot of drinking. Trash restaurants brawled in the streets, gathered in thousands without masks or social distancing. Now, as I say, not so much the outside that's the issue, it's the inside that's the problem. So there will be increasing cases. And what we're concerned about moving on to Europe is the third wave. Now, there's no question this is underway now. It's driven by the new variants. Here we see it clearly in the Netherlands, for example, where there's been an increase in cases of about 25% in the past week. Now, Germany, the Robert Koch Institute for Infectious Diseases, what they do is they model the number of cases now. And of course, they know that in a week, people are going to start getting symptoms. A week after that, or 2 weeks after that, people are going to start getting sick. And a week after that, people are probably going to die. So they model that in and they work out what their intensive care capacity is. And basically, they've just exceeded their intensive care capacity for next month because, of course, the delay. So this is from the Robert Koch Institute for Infectious Diseases. Now, cases per 100,000 per week, currently 104, and the threshold is 100. So that means after the delay, intensive care units in Germany, for Germany as a whole, are going to be over capacity and they're going to have to make additional provisions. Now, because of the increase in cases, this becomes essentially inevitable, because we know that these numbers are going to feed through into some severely ill people and some deaths. France, likewise, intensive care capacity is its highest this year. We know that patients have been taken from intensive care in Paris to be managed in other hospitals. So Paris has already exceeded its intensive care capacity. And the number of people in intensive care increased by 66 in the past 24 hours, now getting on for 4,500, which is a new high for 2021 in France. And of course, the increasing cases in the recent weeks and that are still increasing are going to feed through to that. So far from getting a summer break or an early summer break, Europe is going to have a lot of poorly people all at the same time. Unfortunately, as the third wave, driven by largely the UK variant, but other variants as well. There's a new variant just arisen in France. We don't know much about it yet. But of course, new variants are going to arise all the time. And by definition, the ones that are going to become more prevalent are the more transmissible forms. So it's not looking particularly good for spring and early summer in Europe. And this isn't helping. India, Serum Institute in Pune, it's already announced delays, 5 million less doses of vaccine going to the UK. And here we have less vaccine going to Brazil, Morocco, Saudi Arabia as well. Isn't it bizarre that the world has got itself into this ludicrous situation where we depend on basically one complex in India for a large proportion of the world's vaccines? Quite bizarre. We've known this pandemic's coming for a long time, or a pandemic, and yet that's the situation the world finds it in. So knock-on effects in Brazil, Morocco, Saudi Arabia. Brazil is supposed to be manufacturing its own Oxford AstraZeneca vaccine, but it doesn't seem to be doing so at scale at the moment. Now, Tanzania, we send our condolences to the people of Tanzania for the death of their president, aged 61. Now, the president was a long-term COVID skeptic. He mocked the efficacy of masks. He expressed doubts about testing. He advised spiritual approaches to treating the virus and herbal-infused steam therapy. Now, nothing against spiritual approaches, nothing against properly used and appropriate herbal-infused steam therapy. But they are not curative measures and they don't work instead of. They should be as well as. And officially, the president has died in I've forgotten the name of the capital now. Dar es Salaam, something like that. Dar es Salaam, I think. Probably pronounced that wrong. Of heart failure, but almost certainly. The very strong suspicion is he died of COVID-19, as are many other people in Tanzania, but we don't know how many because records aren't being kept. It's almost, it is deliberate lack of information from Tanzania. So sad that the president's died. How many other people have died, we don't know. So deaths, we don't know. Cases, we don't know. The records simply are not being kept, and deliberately so. So, sad situation in Tanzania. Having pretty well avoided the first wave, now seems to be suffering quite significantly. Now, in the UK, we've got this sort of list that we've been referring to from time to time, and it is this is kind of the timetable for easing the lockdown that we looked at before in the UK. Now, if we look at this timetable, and of course we're kind of here now, the next major thing that should happen to ease lockdown is 29th of March, outdoor gathering, 6 people or 2 households will be allowed, including in private gardens and outdoor sporting events. But what everyone's a lot of people are kind of chomping at the bit waiting for is the announcement that's due on April the 12th. And on April the 12th, we're expecting an announcement to review international leisure travel announced by the 12th of April at the earliest. So we're expecting this to be announced. But it looks like, at least in the early part of summer, international holiday-based travel will not be happening. Because a government minister, I think he's a defence minister, but nevertheless a government minister, is saying that we can't be deaf and blind to what's going on outside the United Kingdom. What he means by that is these new variants that are emerging all over the world. Now a new French variant, the South Africa variant, the Brazilian variant, California variant, New York variant. All of these will just be brought back to the UK and we'll lose all the advantages that we've had. So looking pessimistic for travel in the early stages of the year at least. Now, I think we'll look at some Zoe symptom tracker app data. Let's just look at the main site here first of all, just for today. So we see the prevalence is down to 74,000, but that's still not a small number, of course. People are currently predicted to have symptomatic COVID-19 in the UK. And it looks like the northeast of England's a bit of a hotspot there, doesn't it? That's a much darker red than we would like to see. But going on down, we see that the new case is 4,500, so that continues to go down, which is good. That's the trend that we've seen. Maybe look at the animated version of that. So here we see we've had the summer break. Cases went down in summer, of course. September, they started going up. So we had this increase in cases. Then we had that tiered system. Remember, we had tiers 1, 2, 3, 4. And that brought the cases down somewhat, and that was working until the new variant hit us, the UK variant, and that's what that caused. And then we had the overall lockdown, and then round about there we start to get some effect from the vaccines as well. So that's kind of a potted history of what happened in the UK, shown by that graph there. Now, this is kind of the summary from the COVID symptom tracker app. Now, this is based on 6,565 antigen tests and 1 million people reporting, of course, who I am one, and I expect you are if you're watching this video. Now, this is last week's data, because this is all, the summary data, of course, is always going to be a little bit delayed. So cases over the past week, 4,470 cases on average over the past week, because we remember that where are we here? Remember that the number of new cases today was 4,526. So basically, you'd have to say things have kind of flattened off a bit there, really, on those latest figures, wouldn't you? But that's anyway. That's over the past week. Now, the week before that, it was higher, so it's down from the week before. So that's 2 weeks ago. So that's 2 weeks ago. That's round about now. So down 18% from the last week, which is good, and down 93% from the peak, which was, dear me, we were getting nearly 70,000 cases per day, and that peak was on round about the 1st of January. So down 18% last week, but flattening off this week, it has to be said, in terms of reduction in symptomatic cases in the UK. Now, the prevalence at the moment, the symptom tracker app calculates to be 1 in 823, so this has gone down quite nicely, but as we say, appears to be flattening off now. So that's the UK prevalence of currently symptomatic people. Now, that's the prevalence in the general population. This is interesting. Prevalence in the general population, 1 in 823. Prevalence in school-aged children, 1 in 1,369. And this is after about 2 weeks back at school, isn't it? So we do see that children are being less commonly infected than adults. Yes, we knew that. But there's a lot of children, of course, so even though there's only 1 in 1,369, that's still going to be taking it back to a lot of parents. And we did see that there was quite an increase in cases in that case study we looked at in Manchester a few days ago. So less children getting the disease compared to adults, as we expected, but still an overall fairly large number. So the UK R value for last week, 0.8, England 0.8, Wales and Scotland slightly higher. So that's kind of the summary data for the past week from the COVID symptom tracker app. Still about 4,500 new cases per day though. So it seems to be that the rate of decrease is slowing as the numbers go down. Now, interestingly, okay, it's not a massive survey, but I can't remember how many it's based on, but it's quite large numbers. But Zoe has found no link between COVID vaccination, either of the COVID vaccinations, and the risk of blood clots. Now, we don't expect there to be any more venothromboembolisms, as we've talked about before, these blood clots that occur in the deep veins of the leg and goes to the lungs. What we're worried about is the very, very minuscule increase in the risk of the sinus, cerebral sinus vein thrombosis. Very minimal, but that hasn't been detected by the COVID symptom tracker app. The numbers are so low. Now, Tim Spector comments on this. After steady falls at the beginning of the week, we've seen a levelling off in recent days. That's interesting. So Tim Spector seems to agree with me on my speculations from before, especially in Scotland, Wales and the northeast of England, so as we noticed. So that's confirmed by Professor Spector, who of course is the lead scientist. Now, that's interesting. He says, this is to be expected after reopening of schools across the country and is no reason to worry. So Tim Spector was actually expecting this increase as schools open. And in fact, we did talk about this. We did say that cases will there's inevitably going to be more spread through schools opening. Inevitably. So what we've seen is an increase in children to some extent, albeit 1 in 1,300 children, whatever it was. But that's caused a levelling off in cases in the country generally. And Tim Spector was expecting this based on his COVID symptom data. So it's not surprising. We're keeping a close eye on cases in school-aged children, and so far there's nothing alarming about the data. So this is what he was expecting. I believe we'll see case numbers holding steady for a little while before they drop again. So probably flat for the next week or two, or hopefully not 3, but week or 2, and then they'll start to drop off again. So interesting that we had anticipated this with schools going back, and of course this is exactly what's happened, and it's good to see that Professor Spector's not surprised by it either. It's the price of schools going back. It's that simple. Now, at the start of this pandemic, we were looking at countries like Iran and Russia and thinking, well, what is going on with the poor people in these countries, because there was a lack of data. Now, Russia, we pretty well do have some fairly convincing data from Russia now. So I'll just show you that. Actually, I think I've just shown you. No, I'm going to go back a minute. I know this is appalling, but I'm just going to show you this, because I was going to show you this under England, and what this does is this shows the graph from the Office for National Statistics data, the REACT study, and which of course measures antibodies and antigens, and the COVID symptom tracker data. So we see the 3 lots of data here, and we do see that they're fairly consistent. They're following this generally the same line. So that's encouraging that these 3 different ways of gathering data are the same. So we have the official Office for National Statistics data. We have the COVID symptom tracker app data, and we have the REACT study data, which directly measures antibodies and antigen tests. And they're all coming up with roughly the same numbers, indicating they're probably all fairly accurate. I meant to mention that. Anyway, so that's good. Anyway, getting back to Russia, basically, it's not good news, really. Comparison in Russian death toll. Now, there's been 4.4 million official cases in Russia and 93,500 deaths. Most restrictions were lifted in June. There's essentially no restrictions now in most of Russia. Face masks are mostly worn, though, in public, we believe, in most parts of Russia. Now, this chap here who's a demographer, now I'm only saying his name because he's in the national press. Otherwise, I wouldn't, but it's in the national press, so I think that's okay. If Russia stops at 500,000 excess deaths, this will be a good scenario. Now, what the situation here is that we've got the official death toll from COVID-19 in Russia, which of course is underestimated. It's quite hard to be diagnosed with COVID-19 in Russia. But the data that collects the official excess in deaths, that system actually works. So basically, for any epidemiologist or numbers person who wants to look, they can see that the difference between the number of officially reported COVID deaths and the total excess deaths, many of which will be from COVID-19, of course, are dramatically different. So that's the number of official deaths. Population's 144 million. Is hoping it doesn't top out at more than 500,000. So we see that the death toll in Russia, well, the population's less than half, isn't it? So the death toll in Russia is at least double per capita what it is in the United States. Now, the death toll in the United States is horrendous, but it looks like the death toll in Russia is double or more than double the United States numbers due to gross underreporting. So this chap calculates that the current toll is nearing 450,000. So another 50 or 60,000 deaths potentially to go, probably this year. In COVID, you choose between the economy and people's lives, mostly older people's lives, is a direct quote. The Russian state chooses the economy. They won't say this, but it's obvious. Who's to say it's right or wrong? I'm just reporting what it is. So it looks like the number of people that have died in Russia is not what is on the Johns Hopkins site, 93,547. The real number is probably getting near 450,000, and we're hoping it doesn't go beyond 500,000. So this is these people have been looking at the Federal State Statistics Service, which is quite functional in Russia apparently. So the city of Perm, for example, about 1 million people. In autumn, there was a four-month surge in autumn, the last part of 2020. The official deaths for the whole of the pandemic in Perm was 1,869, but the National Data Gathering Agency in Russia puts that at 2,388, and the excess mortality is 5,683, evidenced by the difference between 2019 and 2020. This being pre-pandemic, of course, this being pandemic. So this is looking like a more accurate way that we're actually getting to some truth about the death rate in Russia, and it looks like it's pretty well double the United States. Now, this chap here is a doctor in Perm, Chief Doctor, Perm Regional Hospital. He says this: you can't leave people without work. Obviously, the best protection would be a spacesuit, but you can't wear that for a whole year, so we look for a reasonable balance. So that's the Chief Doctor in Perm. I'm sure not everyone is promoted to that level. I'm sure there's reasons why it's been promoted to that level. Sputnik vaccine. 4 million doses given out so far in Russia. Health Ministry target of 60% of all adults in 6 months. 4 million. So that's like what, 3% now. So this target has become laughable. Now, the Verda Centre, 30% of Russians willing to receive the Sputnik vaccine. That means 70% aren't. That's 8% down since the beginning of the rollout. And as far as we know, President Putin has not been vaccinated. Now, of course, the French Prime Minister was vaccinated in public. The British Prime Minister was vaccinated in public. President Biden in the United States was vaccinated in public. But as far as we know, President Putin has not been vaccinated. Now, the irony here with this mistrust of the Sputnik 5 vaccine is they started seeming to do this on the quiet. But since then, they've published proper phase 3 clinical trials in peer-reviewed journals. And it's a really good vaccine from all this data. So it's just ironic that this mistrust has been sown in the vaccine from early stages, which is a great pity. Right. Now, I took my mum for a second Oxford AstraZeneca vaccine yesterday, so I was delighted. Surgery rang up and said, "Can you come round now?" So of course I went round, picked her up, and when I was going into the car park, everything was really well organised, and it turns out a local bloke, a volunteer called Paul, has been organising. It's got this one-way system, and it all flows around, and it's all perfect, and it's all good-humoured. So I thought it'd be worth having a chat to him, to be quite honest. So, Paul, let's talk. Right, we're talking to Paul. Paul, you've had a really good idea. It's a one-way system, isn't it?
Yep.
Well, what gave you the idea?
It was just to hold the traffic up long enough to be able to flow back into the car park.
Yeah.
Just to stop any tailbacks going onto the main road, basically.
Well, I'm here for my mum's second jab, which is fantastic. And the first time I came, it was chaos.
Yep.
And this time, we've got you've got all your marshals in place. You do a loop round the car park there. Then you do a loop out there. And then you've actually chiselled through an extra entrance.
Another exit, yeah.
Yeah.
Yeah, but it was after that Friday when we had that absolute chaos.
Yeah.
We had to sort of sit down and kind of draw it out to look at what's doing.
Yeah.
It's taken a few goals to sort of,
get it right.
Yeah, we've got it something like that.
Yeah,
so
yeah.
We'll have done 2,000 today, so it just shows how...
Wow. And there's no congestion at all, is there?
No whatsoever.
So 2,000, one GP surgery in a day?
Yeah. And the very worst of it is, we might get a couple of cars just backed up here, just while they're getting in and out of wheelchairs, and that's it. It works actually pretty well.
No.
The worst case scenario, we can always use that as an extra car park.
Sure.
So it works.
But as long as you've got the flow, it's great, isn't it?
We find that it holds them up just long enough for them to be leaving as they're coming in. It's just a constant loop. So
no, I think it's brilliant, and this is exactly the sort of initiative we need. I mean, you're not a medical man yourself; you've got a sort of technical background, haven't you?
Yeah.
So that someone like you contributes towards the mass vaccination campaign is directly saving lives. I mean, I think it's just marvellous.
Yeah. No, it's good, like I say. But like I say, we, all these guys help. It's not just all these guys the guys that do it, and the girls and stuff that are in the surgery. They're all we're all working every Saturday. So, and
I must say, I drove in. Everyone was friendly. Everything was harmonious. Everyone was told what to do.
I enjoy doing it, to be honest. It's a really good day.
Everyone sees that. As soon as you see that, you think, "Oh, that's a good idea," And and you're away.
It does work really well. It does give a constant flow. And the very worst case scenario, we just have one tail back to the road until it cleared. So as long as we keep this road clear, that's the main thing. My worry was ambulances getting through when this gets congested.
Congested. Yeah.
That's why we did it.
Right, there you go, folks. Every community should have Paul helping out using clear, logical thinking. So good stuff. Model to duplicate for around the world. Paul, thank you.
Cheers,
appreciate it.
Thank you.
For the paper.
We are out.
For the paper.
No, for the videos I make.
You'll never see them through, will they?
Yeah, I've told him the channel is going to leave a comment.
Oh, I see.
Yeah, so there we go, done. Right, we're talking to Paul. Paul, you've had a really good... So there you go, that was me and my mum leaving. Now, it's 24 hours since her second Oxford AstraZeneca vaccine, and she is completely symptom-free, which is excellent. Now, she felt a bit ropey for the first couple of days after the first Oxford AstraZeneca vaccine. 24 hours after the second dose, she feels perfectly 100% normal, so that's pretty good news. Now, what we had there, we had Paul, who was doing voluntary duty in the car park. He thought, this isn't working, there's chaos on Friday. So he talked to the council and he got them to open up this extra bit so the cars could go in, like do a loop round, come back facing the other way, go to the car park, parked in the car park, dropped my mum off. She was back out. She was actually waiting for me not impatiently, but she was back out and waiting for me by the time I'd talked to Paul. And then you saw us drive out of that extra exit that Paul had made. So just one guy there went in, assessed the problem, bit of lateral thinking, got the council on side. And I was there about 1 o'clock, and that one surgery had done 2,000 vaccinations because Paul had smoothed out a through system for getting people in and out. And I'm sure they did another 1,000 vaccines before close of play. So about 2,500, 3,000 vaccines in one area because one guy had actually thought about the problem. So absolutely brilliant. But basically, Paul, I want to thank you because you allowed my mum to get vaccinated. Okay, there's everyone else involved in the team, but you made that flow smoothly, and just a model for people to follow around the world. So great stuff. Now, the last thing I want to do today is get an update from Australia, and a lot of you I know are now fans of Dr. Susan Oliver. So let's get an Australia update from Dr. Susan.
This is Susan from Sydney with another COVID update. Now, in my last update, I mentioned that we'd actually had 2 local cases in Australia, one in Brisbane, one in Sydney. The good news is that it appears neither of those cases has spread further, and we're quite relieved because genomic testing showed that both cases were the B117 variant, which, as we know, spreads a lot faster. So we're feeling very relieved. Of course, as you know, the incubation period is 14 days, so it is possible we still may see some cases, but everyone who is a close contact has been identified and they are all isolated, and they will remain isolated for 14 days after their last contact with the case. Now, I think a lot of people are probably thinking, why are you even talking about 2 cases at such a low number? And of course it is. And we are very happy in Australia that we do only have 2 local cases. We do also have 150 active cases which were acquired overseas. And they do present some risk because, of course, they need to be treated and PPE is not infallible. But the reason we take every case seriously, and every time there is a case, it makes the news in Australia, is we know in Australia how quickly one case can turn into 100 cases. And we saw that in Sydney over Christmas. We had 1 case escape from hotel quarantine. We don't quite even know how, but there was a super spreading event at a local club that infected 30 people. Those people then went to other places, and before we knew it, there was 150 cases. And some experts were predicting that we would be up to 1,000 cases a day by New Year's Day. We weren't, because we've done this before, and we contact traced every single one of those 150 cases. every single person was isolated. Also, the local area where the cases had emerged was put into lockdown. Those people had a rather miserable Christmas, and other people really appreciated the sacrifice that they made. At the moment in New South Wales, you might notice I'm wearing my wet weather gear. I've just come in from outside and it is absolutely bucketing down rain. It's, for me, it's just I guess an inconvenience, but for a lot of New South Wales, it's a lot worse. Parts of New South Wales are experiencing the worst flooding in 100 years. That means a lot of people have had to be evacuated from their homes and they're going to evacuation centres. So can you imagine, just if you just had one case in one of those evacuation centres, that could just spread like wildfire because, you know, evacuation centres aren't designed for social distancing. They're not designed with good ventilation, et cetera, et cetera. They're just designed to give people somewhere safe to go. And by the way, people can also take their pets if anyone's worried about what's happening with the pets. Now, onto the vaccine rollout. We're now up to 250,000 people in Australia who have been vaccinated. That's about 1% of the population. So we've still got a way to go, but we're getting there. And tomorrow is V-Day. It's not really called that, but I thought it sounded cool. And that is the start of the phase 2B and using our local supplies, which have just been approved by the TGA. So phase 2B is over 70s, Indigenous people over 55, people of any age with certain high-risk conditions, and also people who work in high-risk professions. So they will be the healthcare workers who weren't already in phase 1A, and people who work in meat processing factories where we've actually had quite a few outbreaks, and also emergency services personnel. Now that rollout will be across initially 1,000 GP clinics, but it will be ramping up to 4,500 over the next 4 weeks. Now there was a little bit of a palaver with the rollout because on Wednesday just gone, the government sort of put up a website that had details of the 1,000 GPs. Now, in phase 2B, there's 6 million people included, and it's probably a bit of an exaggeration, but quite a large proportion of those 6 million people rang the 1,000 clinics. And of course, the poor receptionists were absolutely inundated with phone calls. But there is a silver lining to it because it means there are a lot of people in Australia who are very keen to get vaccinated, and we really do want as many people to be vaccinated as possible. There will be in New South Wales, because of the flooding which I told you about, that is going to be delaying the rollout because a lot of roads are just blocked, and so the supplies can't get through. But hopefully that's only going to be a temporary setback, and hopefully all the people in the flooded areas are going to stay safe, and I hope you all stay safe too. Thank you.
Where am I? There I am. All right. Susan, thank you so much. Also, that excellent update. Just think of it, that the B117 could have escaped into Australia and it would have been disastrous. It would have been exactly the same cataclysmic situation as in the UK, necessitating national lockdowns. And you avoided that with 14 days isolation of two cases. 150 cases, all being quarantined and isolated. 1% of the population vaccinated so far, but I do know you're targeting the most at-risk people that work in the quarantine centres, whereas where the imported cases are getting in. And great to know that the vaccines produced in Melbourne are hitting the streets, hitting the clinics tomorrow. So absolutely marvellous. Thank you for that excellent update again, Susan. Very perceptive and informatively done. We appreciate it. And thank you for watching this video, of course.